Good morning. We're here at the Lakeshore Clinic in Burlington, and we're all talking about wellness today. Mental, physical, emotional wellness. And I'm here with Masa, and Masa, you are a homeopath. And a lot of people don't realize that this is one of the many services you can get done here at the Lakeshore Clinic, from massage therapy to laser and chiropractic. But let's talk about the immune system, because right now it's top of mind for a lot of people. Right, because, obviously because of the virus and the pandemic, but you're saying this is like a lifelong deal. We should really be thinking about our immune system our entire lives.
That's very true. And we all know the impact of stress in our immune system, and it's proven. And with this stressful situation of now, I think we need to use therapies to strengthen our immune system, because this is the main asset that we have in life.
Yes.
To
everything.
Fight the disease.
Yes.
And homeopathy is one of the modalities, treatment modalities, that actually gives so much importance for mind and body connection. Look at a person as a whole. And the main thing in homeopathy, and I believe that it's a great adjunct to our conventional medicine. In conventional medicine, while they try to fight the virus or limit the virus with their treatments such as antibiotics, antiviral medicine, and so on, homeopathic approach is very different and approaches the person from a very different angle. Basically, it tries to mimic body's own attempt for healing and boosting or stimulating body's own natural immunity to fight off the disease.
Right, and we're looking at some of what you would see typically in homeopathic treatment, but what's great about this type of treatment, it is great for everybody, for kids and even pregnant women and grown adults, right?
Yes, it is safe for all the ages, including breastfeeding women, newborns, and pregnant women. But it needs to be applied by a professional homeopath.
Right, you're not doing this yourself.
I don't believe in over-the-counter. Yes,
exactly. And describe how generally homeopathic medicine is administered.
First of all, the medicines are from natural sources, mostly from plants, minerals, and some animal sources. But at the same time, they're very different in approach with herbal medicine or even naturopathic medicine. They come in different forms, in pellet forms, in little tablet forms, or sometimes in liquid forms. And the treatments are very, very individualized based. So we don't have just one remedy for cold or one remedy for this, because it's not a symptom relief type of treatment.
It's specific for that person.
Yes,
right?
It's very individualized based, and we need to assess the person to come up with the right natural substance to stimulate the immunity.
Wonderful. So we're at the Lakeshore Clinic again here in downtown Burlington, right on Lakeshore, and people can come in, people can talk to you, and for all different ailments, right? For head to toe, whole body, and not just immune system, but something obviously we need to focus on right now. But there's so many different issues that people are carrying around with them that could be easily addressed by homeopathic medicine.
Absolutely.
Right? Thank you so much, Masa. Thank you for being on the show with us today.
Thank you so much for having me.
We have lots of adventures here in downtown Burlington this morning to help with our general health and wellness and our mental well-being.
Roll. Push up.
Okay.
Go. One more.
How many of these are you going to make me do?
Push up. Roll. And again, nice and high now. Feet on the hill climbers.
Okay.
Let's go.
Okay.
20 seconds. Let's go. Nice and high, nice long legs. Nice
this
big
isn't
stride.
a long show, I can't do
solid core.
I'm
All
here
right.
with Ian, by the way.
We'll go 5
I
and
get to
stop.
cheat, because I'm here and we only have a couple of minutes to talk. Ian, we're here at Strive Strength and Fitness.
That's right.
Downtown Burlington.
Yes.
Just off Brand Street.
Yes.
Tell me, people are struggling, they're working from home. Give us some tips.
Well, what I always advise people to do, if they cannot motivate themselves to do 1 hour of working out per day, then break it down into 10 minutes. So you can have 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes in the evening. Try to do some sort of resistance exercise like you've just done there for the 10 minutes in the morning.
Quick.
And
easy.
yeah, super quick, only need a band. You can do that on the wall.
Right.
You can do your poles and your rows on the wall.
Okay.
Medium is on the bench.
Sure.
So you're at an angle, and then straight into the floor, get that heart rate going, maybe 3 or 4 times. Morning, afternoon, then go for a walk or a run in the evening, get outside.
Some other tips for people that are home, they're sitting at their desks. We're not moving as much. We're not walking to other offices in our office building.
Yes.
We're not walking to get a coffee because our coffee's right there.
Exactly.
People need to move. They need to stand up.
They do. They need to get going. Now, a lot of people come in and they've got posture issues because of sitting at home. And unfortunately, a lot of people weren't prepared for COVID, so they don't have the home office. So a lot of people are working from kitchens, they're sitting on the end of the bed, and the posture's starting to give them back problems and so forth. So I always advise people just to set an alarm for 15 minutes. As soon as the buzzer goes, correct yourself, chest out, shoulders back, nice solid core, continue. 15 minutes later, the buzzer will go, and eventually you'll actually create your own good posture.
Right. You have to remind yourself of this because it's so easy to get engaged in your work, right?
Exactly.
And then all of a sudden 2 hours has gone by and your hamstrings are tight and you can't get up.
Exactly.
Right?
Yeah, you've got to get up and you've got to move. And even pre-COVID, everybody's on, but even then you should still be exercising regularly.
Yes.
I mean, I started exercising a very long time ago, so did yourself, and it's never stopped.
Right, and then it just becomes part of your life.
Exactly.
And that's what you want it. You want it to be a lifestyle, right?
Exactly, yes. You want to make it so you feel worse not exercising than you do exercising. You want to make it part of that life. So if you miss that hour, you know you've got to get it back in.
Exactly. So you have this amazing facility here, and so people can come and do one-on-one training. That's what
I do, yes. So Strive Strength and Fitness is a private personal training studio. It's just one-on-one. I customize one-on-one training programs for whatever the client's health and fitness needs are, whether it's weight loss, rehabilitation, strength and fitness. We can do it all here, safe, private.
All walks of life. You've worked with firefighters. You've worked with
I do, yes.
all kinds of. So you're
I
going
have
from
everything. Yes,
from the elite
I have athletes.
to,
I have older people coming in who just want to stay healthy and fit. I have people with knee problems and so forth.
Post-surgery,
post-surgery, pre-surgery is a big one.
Sure.
And I train a lot of firemen and people who just like to stay fit.
Wonderful. Well, thank you. Thanks for the tips. And again, these bands are handy. People can even learn some more tips from you. Just come here and learn how to use your bands at home because people don't know what to do with these things.
Exactly. Yeah. All
right.
And you can just throw it. And it doesn't damage anything.
I know, it's amazing. It's amazing. All right, I'm going to finish doing my little mount climbers because I like them, but I'm going to ditch that.
All right, 20 seconds.
Out I go. Okay.
Solid core. Let's go. Drive them legs.
Thanks, Ian.
Drive them. That's it.
We are here at Kinetic Physiotherapy, and I'm here with Christina. We're downtown Burlington right now, and a lot of people have changed their habits over the last year, as we've been talking, of course, because of the pandemic, and we're getting a lot of issues with typing, holding phones, wrist issues, and all the way up through into our arms.
Yes.
You're going to give us some tips and help us identify what the problem is.
Yes, yeah. So there's definitely been an increase of wrist issues coming through the clinic because people are on their devices a lot more and they're moving much less. So some of the common wrist issues we're seeing, of course, are carpal tunnel. So those common symptoms are going to be pins and needles in the first 3 fingers and maybe some weakness with picking up your pen or keys. But the biggest one I'm seeing is wrist pain in the actual joint itself. And the common complaint is when they're using weight-bearing activities with their wrist extended. So a lot of people are doing at-home workouts, getting into yoga, Beachbody, Peloton, and they'll say, you know what, Chris, when I do plank, push-up, chaturanga, I'm feeling a lot of pain in my wrist.
So basically, when they're trying to flatten their wrist out on the floor in a plank position like this, this is killing them.
That's right, and they feel it right in the wrist joint. And so I get them to do a nice, quick, easy assessment that people can do at home. Of course, here we're much more thorough than this.
Yes.
But if you wanted to check to see if you have an appropriate amount of extension to get into those repetitive movements without injuring yourself, you can put your forearms together and make a fist, and then extend your wrist back. Straighten your fingers and try to actively pull your hands down. So we want at least 90 degrees because that's the angle at which those movements require of your wrist. But a lot of people actually come in with like this.
Or they're crooked.
That's right. Or like ones like this. And it tends to be their dominant hand that they're, messaging people, connecting with people over social media, doing, virtual meetings or interviews. And so they're just kind of keeping the wrist in more of a tightened position instead of mobilizing their wrist.
So how can they help get that mobility going?
Yes. So if you recognize that you have a lack of mobility, instead of continuing to push through it, first and foremost, for sure, book in with a reputable therapist. They're going to be able to assess you appropriately and give you a customized program based on your activities, your job, what you love doing. Next, what I would suggest is take breaks and move around. We have to get our blood flowing. We have to keep changing positions. And then a nice exercise that I like doing that's easy and simple for people to do, if you have a tennis ball at home, a lacrosse ball, we kind of tend to have these kicking around. You're gonna try to increase the pliability of your tissues and decrease the tension in there by doing some myofascial release. So what that would look like, you'd be sitting down, I'll just kneel for the time being, but you're just gonna place the ball on the forearm, anywhere along the forearm, and you could just roll it, okay? So almost like foam rolling.
I can see that feeling very good. Yeah, it's like a foam roll. Yeah.
Exactly. You could do that, and then what you can do is when you find a tender spot, pin it, and then you're gonna move your wrist into extension. So we're stretching the muscles over the ball, and this just becomes a little bit more functional, so you're not missing any of the tissues.
Wow, okay, good information. Now, again, this is Kinetic Physiotherapy. We're downtown Burlington. Anybody who's having issues with their body, again, it's one whole thing we have to deal with, not just little things, right?
That's
and I know you can help keep us in a line and help us heal. I know I let things go too with injuries. Come and visit Chris and your family here, and we can help sort of sort things out, especially now. We're not going to work anytime soon, really, so.
No.
Right? A lot of people are doing the office work, so you gotta help and get this sorted out. We have lots more to tell you and show you here in downtown Burlington. Thanks, Chris.
Thank you.
We've been spending our time downtown Burlington this morning, and we're now here at Peachy Counseling, which is in the upper level here, just off of Pearl Street, and a really great place that we need to talk about. We just need to talk. So I'm here with Kate. Kate, you're a social worker, correct?
Yes, I am.
Okay, so let's talk about, we're 1 year into the pandemic right now, and people are struggling mentally and emotionally, but they're not really sure and can't really identify some of the signs and symptoms.
Right. So we talk a lot about burnout. Being a year into the pandemic, people are feeling really physically and emotionally exhausted. And that can come out in various ways. It can be more internal, where people are struggling with thoughts around, I'm not enough, when is this going to end, uncertainty, but also can be externalized if they're finding themselves being in more conflict with their kids or their spouses or workplace colleagues. It can come out in various ways.
So people are feeling almost like maybe a little bit more short, agitated, irritated, and they're really just, but as you say, sometimes we don't identify that. We're like, oh, you know what, maybe I just didn't get enough sleep last night. I need water, I'm dehydrated, you know what I mean? But you're seeing people coming in with these issues, maybe a little different than what you were seeing a year ago.
Oh, for sure. I think the kind of the year that we've had has been so many ups and downs in terms of being in shutdown again over the winter time. People are now thinking, okay, I'm feeling more of a lack of motivation. Is there really a light at the end of the tunnel here? When are we going to get to a place where I feel more normal? Is this going to be a new normal?
Right.
So it's kind of more sinking into a deeper emotional state for people.
Sure, and a year is a long time, right? So some people have been moving less exercise, which we all know we need.
For sure.
And but it's again a lot of the unknowns.
Yes.
Not being able to plan, and just not being able to have those freedoms that we're used to, correct? So maybe if, obviously we always encourage people to get help and sit down and talk to you, but let's talk about maybe some tips for people at home right now that they can maybe get on it today.
Yes, I would say checking in with people that live in your house is so important, especially around kids if we're trying to teach them how to vocalize their emotions and really be validated by their parents. Validation is so huge in terms of saying, I hear you, of course you feel this way, there's a lot of uncertainty, and it's okay to have days where it's less productive. It's okay to have an off day. Not everything has to be positive. We can lean into those moments.
You know what I found too, just with my son, so he's 12, and it does come out in kids too, and of course this is affecting children. They can't play with their friends like they want to. They're obviously playing more video games. I know I'm letting my son because he can communicate with friends that way, live gaming, right? Yeah. But yeah, he sometimes, I know he just needs a day off school, and that's okay.
Yeah,
right?
Completely. Completely.
So, maybe some other tips you're saying, gather the family around in the house and just openly talk.
Yeah, and not to put judgment on it, just letting everybody kind of be as they are, and really validating that, yes, it's a scary time. Yes, there's a lot of uncertainties. There's a lot of hopes that were kind of dashed as we go back into lockdown, into a third wave, and really kind of sitting with those things and making sure that everybody feels heard. And I think that's a huge step to kind of opening these sorts of dialogues and kind of lessening the emotional intensity of it.
Makes sense, makes sense. So if somebody wants to come and maybe talk to you, people can just reach out. It's Peachy Counseling, correct?
Peachy Counseling and Family Support.
And family support, and then they can sit down. There's a group of you here that people can chat with.
Absolutely.
Oh, help us get through this, right?
Yes.
The final and third wave.
I know.
Thank you so much, Kate.
Thank
That's
you
it for
so
now.
much.
And that's it from downtown Burlington.